Okay, so today, as part of Menopause Month, we're speaking to Claire Doherty. Claire, would you like to introduce yourself?
Hi, I'm Claire, for those people that don't know me, and I am a medical intuitive, which basically means I have a scientific background, but I am also a holistic practitioner, and so I pull the two things together. And medical intuition is not about being psychic, as some people ask me. I don't predict your future health or anything like that. What it means is that I look at patterns in your body, and I look at the symptoms, and I'm able to discern from learning about your past lifestyle and your past medical history what is going on with you at the moment. So for example, there are certain patterns of symptoms that will present in the body, which might always indicate that somebody has got some problems with money, or stress around money, or is worrying about a female person in their life, or is worried about, you know, the amount of load that they're carrying, or they're carrying other people's burdens. I mean, that's a very basic kind of overview. There's a little bit more to it than that, but that is basically what it means.
Wow. So in terms of helping women going through perimenopause, presumably that means that you have any number of strings to your bow to help.
Yeah, so it came about basically because I was already working with nutrition and physio, that I realised that there were certain, I suppose, symptom patterns and certain things that would appear in clusters and groups, and that when I got to know people better, that they would invariably be experiencing the same things in their life. And so female hormonal issues, as we know, are not confined to one place in the body. So, you know, one person might be having hot flushes, one person might be feeling really bloated, one person might have insomnia, etc., etc., etc. The list is, as we know, endless. And so within the sort of perimenopause kind of bracket, if we'll say, or you know, group, there will be kind of subgroups, and so not everyone going through the perimenopause, as we know, experiences the same things for the same reasons. And this is why I like working with people on one-to-one level, because it's quite easy to kind of jump in and give advice, and that's quite generic, and sometimes it's really helpful and it really helps women. So somebody might be struggling with bloating, and I might be able to say, yes, try some apple cider vinegar, or chew some rocket leaves before, you know, you have your main meal, because it will help your digestive juices, and that might help you. But it might not, because they might be getting bloating for a completely different reason. But on top of that, there is often an underlying emotional, energetic, I don't want to say issue, but factor that is influencing that bloating. And so what I do is I go in and I look at all the layers. So I will look at the fact that somebody's got bloating, and then I will try and work out why they have on a physiological level. But then I will work out, well, where is the bloating? Is it in the upper part of the stomach? If it's a yes, well, is that because maybe you're going through a period of transition and you don't think, you know, your self-confidence has gone down a little bit and you're not trusting yourself, because this top area of the gut is all to do with our intuition and how much we trust ourselves, you know? Or is it in your lower gut, and is that actually to do with something else, because, you know, you're actually really annoyed with, you know, your boss at work, and you've got a really stressful job, and that's the area that we often hold on to anger. So it's a really, really interesting process, and not everyone likes it, and that's absolutely fine. And I don't go there with everyone. I only ever, you know, work like that with women that are open to it, and that, you know, either I suggest it to and they're happy with, or they ask me. It's not something that I force on people, because some people don't believe in it, and I respect that, and that's completely fine. But for me, I think it's added a lot to the way that I work, and to what the people that I work with have got from it, really.
So have you found that the women who are experiencing the worst perimenopausal symptoms do tend to have other factors to sort of unravel, for want of a better word?
Yeah. And I think the more symptoms that we have, the more complex it is. And it's sometimes not the more factors that you've got to unravel. It might be that you've got one thing, but you've had it for such a long time that it's kind of affected lots of other things within your body. So just like stubbing your toe really badly and ignoring it, and then forcing your feet into a pair of pointy shoes going to work, could then actually mean that you don't walk properly, so you get ankle pain, and then you get knee pain, and then your back hurts, and it gradually moves up. It's the same sort of thing with emotions that we don't acknowledge, or that we don't allow ourselves to release. So over time, the longer that we hold on to things and we don't acknowledge them, you know, your body is a little bit like a volcano, so it can lie dormant for a long time. But if we've got something bubbling away underneath it, you know, we can reach a tipping point where actually it goes, I can't hold on to it anymore. And you get this kind of explosion, and it presents as physical symptoms in a lot of people.
Yep, all makes sense. So once you've identified the underlying factor or factors, does your client or patient, whatever word you prefer, need to then address those on their own, or do you address them with them?
No, I do it with them. So you know, it is my belief that through our life we are constantly in this state of flux, and we're constantly changing, evolving, whatever you want to call it, growing, whichever word you want to use. And so therefore we've always got internal work to do, or things we can do internally that help us. And by internally I mean emotionally and mentally. So it's kind of an ongoing process. Now, that's not to say that if you work with me that you'll work with me forever. That's not what I mean. What I mean is that I would support you and give you things to help you, and then you go away and try them. But it might be that you have to keep revisiting that in years to come as a tool, because you then have that to kind of fall back on. So there's lots of things that you can do. I might say to you, actually, I think that you really need to go and see a counsellor, or I think you'd really benefit from hypnotherapy for this part. So I'd refer on to somebody else while I then continue to work on other parts. So it's not by any, you know, shape or form the be all and end all at all. It's like any other practitioner. We have our limitations, and you know, my scope of practice isn't endless. So I'm often saying to people, you know, I think that you might benefit from going to see a counsellor, or you might benefit from going to see, you know, back to your GP, because you might need some support with, you know, some medication, you know, something like that. But yeah, the people definitely aren't left out on their own. And somebody wouldn't say to me, you know, I think it's because of X, Y, or Z, and I go, okay, that's good then. No,
that wouldn't be helpful.
Yeah,
but that's interesting. So you'll refer people on to any other course of action. Whether it's GP, whether it's holistic, whether it's
definitely.
Okay,
so for example, if I'm working with somebody on Skype and I say to them, actually, I think you could really do with some massage, somebody touching you, somebody to help you kind of, you know, help you feel your body again, because touch is one of the things I think we really undervalue in this modern age. You know, a lot of NHS physio departments don't touch their patients anymore, and that's just because of time constraints and financial constraints. But it's a real shame, because, you know, touch is really healing. So I might say to somebody, okay, I'm going to get you to do this exercise, and I want you to write these things down. I'm going to look at, changing your behavior. We'll do it this way. In the meantime, either go to your GP and see if you can get referred for physio, or pain, go and see a masseur, something like that. So I don't think you can ever support yourself too much. And I'm always a bit wary of, if I go and see someone, I work with someone, and they say to me, "Oh no, you don't need to go and see anybody else, because I can get it all better by myself." I'm always a little bit wary of that, because we are multi-dimensional beings, and because of that, I think we need lots of different approaches, or I think different approaches help us. So, and it's always good to get different opinions as well. And the idea with medical intuition is that it's complementary to other things. It's not the be all and end all. So it's more about inviting people to reconnect with their bodies, because I think that we have moved so far away from understanding our bodies and what they're saying to us, that we just don't get it anymore. And we do live in a fast-paced world where we want everything now, and because of that, we are quite reliant on medication, and there's nothing wrong with medication, and because medication tends to work quite quickly, and because we live a fast-paced life, we tend to want results quite quickly. But maybe that's not realistic in every case, and maybe sometimes when things have been going on for a long time, it's going to take a little bit longer to sort them out. And I think we can lose sight of that, and I think we can almost expect that we shouldn't be having certain symptoms, and if we have them, then we should be able to get rid of them quite quickly just by taking a pill. But your body is an absolutely remarkable piece of art, almost living art, and it's so complex. And I think that we've just completely disconnected from our bodies, and we kind of live in our heads. We're always thinking about yesterday or tomorrow, or stressing about something, and we're not actually really listening to what's going on, or trying to understand why our symptoms have developed. Because some people do have a really easy perimenopause, and even an easy menopause. They're not everyone suffers, and there are there's lots of reasons because of that, and so considering our emotional needs, I think, is one of the factors that we don't really look at very much anymore, but has a really big impact when we do.
Yes, I think we're quick to sort of take, not that quick to, but the labels of mental health illnesses are used quite frequently, but the emotional health before that isn't always addressed, is it?
No.
And just as with physical health, if you saw that you had signs of something changing, you would get it checked out. Absolutely. Potentially sooner than it becoming a big problem. And we absolutely should be doing that with our emotional well-being as well.
Definitely. I just think it's one of those things that's got lost, like years and years and years ago. I think that everything was so different for women, and we've almost forgotten how to listen to our bodies, and almost forgotten that actually this whole cycle, just the menstrual cycle, never mind the whole cycle of us going through puberty and and then perimenopause and menopause and postmenopausal and all that, but even just the simple menstrual cycle is actually something that is really, really special. I know most of us don't feel that way because of the symptoms we get with it, the PMS or the pain or whatever, but when you think about it, it's like a miracle every month, and we've kind of forgotten about that because we're it's an inconvenience for most people, and it's not very pleasant. And we have to go to work and we have to do the same things on those days. And years ago, that probably wasn't, well, it wasn't the case, and women were treated very differently to how we are now. But all of that, we carry all that with us in our bodies, and we're not always aware of it. And it does have an impact on us, definitely.
Absolutely, I agree. And it's actually why in the webinar I recorded with Susie the other day, we covered just the basics of the menstrual cycle, because actually that's how we live sort of 30 years of our life or
Absolutely.
more, is in this cycle. And yes, your energy fluctuates, and yes, you bloat sometimes, and yes, you're an angry person sometimes, and all the rest, or a tearful person, but none of that's bad. None of it, it's just part of being female. And I know I've noticed for myself that since just tracking my cycle in an app on my phone, I now know where I am, so I know what's coming.
Yeah.
And
exactly.
even that is just, it lifts a weight.
Yeah. I mean, there's some people that say when you become more emotional, it's because you're being more true to yourself, and you're showing your true emotions, and you're also a little bit more intuitive. So rather than us going, oh, I'm too sensitive, it's actually not. It's just that you're really, I suppose, you are connecting with your feelings and your body more at that time. And being irritable and angry is also can be because you're not allowing yourself, or you feel you're not allowed to really say what you want to say, or and again, it is because you are sensing things more, and things where you might not bother you at the other days of the month because you feel that your skin's a bit thicker to it. It doesn't mean there's anything wrong with you. It just means that your senses have become more heightened. But I think we've demonized all that. We've put it into this box of PMS, and it's bad, and if you get sensitive or you cry, oh, that's bad, you shouldn't be doing that. But actually, why shouldn't we? And all right, maybe we shouldn't be crying and feeling like it's the end of the world, or we want to kill ourselves. No, definitely not. But to be able to be emotional is a really special thing, and we should be allowing that, not trying to get people to deny it. It's just it's all gone a bit wrong, really, hasn't it? But we're here to put it right, aren't we?
Yep, that's right. But it's true, we have spent so many years trying to be equal to men, which means absorbing our emotions, absorbing our natural femaleness. And actually, perimenopause is an amazing time for just going, do you know what, I am who I am. This is who I am. I've run out of shits to give, and now I'm just being me.
Use that other word.
Yeah, I was really careful there. But I think, and it's where the work that you do is brilliant, because it can help us to understand what it is that we need no longer to be giving a shit about. What things can we just pare down in life to make it happy going forwards?
Yeah, absolutely. So I wouldn't ever, people don't come to me and I don't sit there and kind of look at them and go, right, okay, I think you've got this problem because actually you're really angry with your mother since you were 7. What I do is I talk to people and I ask them, and based on their symptoms, I might say, is there a man that's annoying you, or you're angry with, or you feel resentment for? And they might say no. And then I might say, well, has there been in the past? And, think back to this, and then somebody might say, actually, there was, but that doesn't bother me anymore. And then we might talk about that. And then they might realize, actually, they are still a bit bothered about it. And we kind of explore things together a little bit like that. I don't ever tell people this is what is causing your pain. I just invite people to explore it. And then it might be they'll go, there absolutely isn't anything like that in my life that has bothered me or ever bothered. And I'll say, well, that's fine. It's not that then. And if we talk around some other things, we might find something that we think is stressing somebody or bothering somebody, and we might not, we don't always. Most of the time, I would say 95% of the time or even higher, people do go, oh yes, there is this thing. But if there's not, there's not. It's not my job to tell anyone what is going on in their body. I'm there to try and get people to understand their body better. So, you know, I'm not a medical intuitive, isn't somebody like the medical medium that will say, you know, you need to drink blueberry juice every day for the rest of your life because that's going to get rid of your, you know, night sweats. It's not like that. It is more a reconnection to your body and trying to understand your body and other things that might be contributing apart from physical kind of imbalances, which is where the nutritional therapy side comes in, or well, no, hormonal imbalances does still fall under that, but it's just another angle to look at things from, basically.
So in simple terms, you're basically a facilitator between head and body for your patients.
Absolutely, yeah, absolutely, yeah.
Which we need more of, because we have, as you say, we've completely lost the tuning in between, even just in really simple terms with hunger. We've lost the ability to acknowledge that we're hungry or full. And so if you extrapolate that out, obviously it's going to get quite complicated.
Yeah, no, it's true. Absolutely.
Awesome. Wow, that's been really, really informative. Thank you so much, Claire.
You're very welcome. Nice talking to you again.